you've used ChatGPT to try to diagnose yourself, or if you're building a doctor's assistant that triages patients, you'll want to hear about this latest research. Hey everyone, I'm Sahij. On my channel, I try to understand some of the latest advances in AI and how they can be used to improve healthcare. I'm a clinician and a bioinformaticist who trained in the US, and I head product at a managed healthcare company in India. So I'm especially interested to understand how these technologies can be used to improve healthcare quality and make it more affordable and accessible. If that sounds interesting to you, I'd ask you to subscribe to the channel and follow along. So let's get into the paper. The paper is called An Evaluation Framework for Clinical Use of LLMs in Patient Interaction Tasks. I'll link the full paper along with this video. What they're basically doing is testing if an LLM can have a conversation with a patient where they find out the patient's problem, symptoms, medical history, and other details, and finally make a correct diagnosis. So what exactly do they find? They find that even though these models are very good at solving exam-style medical cases, it doesn't mean they can talk to a patient, get the right details, and ultimately arrive at a correct diagnosis. So how do they test this? There's a pretty good figure, which I'll show you right here. They basically simulate a patient-doctor interaction using AI and then use AI to evaluate the doctor itself. The manual way you can imagine would be to hire patient actors, have them talk to an AI or LLM, and then have other doctors grade these AIs, which would be very costly and time-consuming. So this is an automated way, which is a new way that they propose, and they use this to test some of the latest models that are out there. What they basically do is create 3 agents. So one is the doctor agent. This doctor agent is prompted to ask questions to the patient about their medical history and other details until it is confident that they know the patient's diagnosis. The second agent is a patient agent. The patient agent is prompted to answer the doctor's questions in layman's terms based on a clinical scenario that they give the patient AI. And the last is a grader AI agent, which basically checks for the doctor's ultimate diagnosis. How do they create the patient simulations? Well, basically they repurpose a data set called USMLE QA. It's a practice question bank of questions that medical students use to test their diagnostic skills. A typical question looks something like the case vignette that they show in the paper, where you're told about the patient situation, any presenting issue, related symptoms, exam findings, lab findings, and the question will ask the student to guess the correct diagnosis out of 4 or 5 options. In this paper, they basically use the clinical scenario in these question stems to create patient AIs who are mimicking the patients in those scenarios. So, for example, you have a case vignette of a patient who's been admitted to the ICU, who had a sudden rash across his trunk and arms. And so they give this case to the patient AI and basically ask it to simulate being a patient. So you have the patient here saying, I've got a sudden rash with blisters all over my chest and arms. The doctor AI then says, what is your age and sex? The patient AI then says, I'm a 55-year-old man. This is coming from the case itself. The doctor then asks, how long have you had this rash? The patient then says, it popped up suddenly, which is again coming from the case vignette, which says sudden onset, right? So this is how they create these patient AI simulations, and then they have it talk to a LLM like GPT-4 who tries to get information from the patient and diagnose the patient. They do this for about 2,000 cases, 1,800 of them which are from this USMLE question bank. So what do they test? They basically test a couple things that are really important. One, how does a doctor AI perform when given the practice exam question? And then compare that to how does a doctor AI perform when they're interacting with a patient AI who is simulating the information in that practice question in a conversation. So on the left side, you see the A and the B. That's the thing that I would focus on right now. So you have the Dr. LLM answering questions based on the practice question. And then you have another scenario where the Dr. LLM talks to the patient and then tries to guess the diagnosis. The Dr. AI has the option of picking the correct answer. And then they also test a scenario where the Dr. AI is not given any choices and just has to guess the correct diagnosis. So what exactly do they find? This is an important figure. They basically find that for the practice question, GPT-4, for example, which is their best performing model, gets the correct diagnosis 82% of the time when it's a practice question. But when you turn it into conversation mode, the correct diagnosis is given 62% of the time, and only about 26% of the time when it's an open-ended answer, meaning an open-ended question. The Dr. LLM just has to talk to the patient and then guess without being given any options what the correct diagnosis is. In that scenario, the accuracy of diagnosis is 26%, down from 82% in the exam-style question answering. And that's for GPT-4, which is arguably the most advanced model out of the ones that they test. They also test GPT 3.5, Mistral, and Llama, which are other frontier LLMs. An important thing to note, they tested this, I think, initially in 2023, and then they've been in the process of going from a preprint paper to a full paper. The other thing that they find is that they take a subsample of the doctor conversations and they ask real human doctors to evaluate those conversations. And when they do this, they find that the AI doctor does not ask critical patient details about 30% of the time. It doesn't completely gather the relevant medical history, and it continues unnecessarily having a conversation even after a diagnosis should be clear about 50% of the time. So meaning it rambles and keeps asking when to a real human doctor, the most likely diagnosis may be clear and the next steps may be apparent. So again, this is for GPT-4, which is their best performing model. So I won't get into the full set of tests that they do, and they do a significant number of them. They test out things like questions with images. They also test out whether you're able to rescue the doctor's performance by giving a summary of the patient conversation, a bunch of things which are very useful and important tests. So if you're building this sort of tool, or if this is interesting to you, I would encourage you to read the full paper, again, which I will link in my comments. But that's it overall. So what exactly did we learn? We learned that in open-ended conversational style history taking and diagnosis, LLMs will struggle to ask the right questions or gather the right info and arrive at the correct diagnosis, especially when the task is open-ended and you're not giving the LLM answer choices to pick from, which is much closer to the reality. Two, if you are an LLM provider, if you're building products that might do something to this effect, you should be testing on this benchmark. There are an increasing number of benchmarks, Earshot, EHR shot, which are creating clinically meaningful tasks and are open source, which LLM providers and product developers can test against to see the usefulness of their LLMs. And then three, if you're a normal user consumer, you should be using your LLM or ChatGPT wisely. Just understand that you might see tweets where people have said that I got this rare diagnosis suggested from ChatGPT, which no other doctor might have gotten, and just be cautious of using that as a sign that these LLMs can make diagnoses and talk to you to gather the right information all the time. So what questions remain? I would say this is probably a rosy picture of AI because in real life, patients might give you even lesser information. In this case, the patient AI had practice exam question as reference, And practice exam questions are designed to literally give almost all the information a doctor needs to, make the diagnosis in the exam. But in real life, the patient may not tell you certain things, or they may not remember certain things. And in that scenario, how well does the AI perform in diagnosis would probably be even worse. Also, this is the setup that they evaluate for an AI making a diagnosis is probably the simplest, you could say the most naive way that it would be implemented. You'll see companies like Cure AI or Hippocratic AI that have published white papers or research papers on their setups for AI doing this sort of task. And those setups are a lot more sophisticated. They'll have not just a doctor AI that does the interviewing as well as the diagnosing, but they'll break that down into further parts. So they'll have one agent that has the conversation, another that extracts symptoms, another that creates a differential, another that updates the conversation. So using multiple agents, the results of this evaluation may differ. And so what they have tested in this paper is probably the simplest, most out-of-the-box way in which a product developer might be developing, but also how we may be using ChatGPT or other tools to diagnose ourselves. Last but not least, so in real life, a doctor doesn't just have to guess what's the most likely diagnosis, but has to decide what's the next best step in this patient's care. What is the next best test that I need to order or medication that I need to give to relieve symptoms? And if you ask the doctor AI to answer those questions, the performance might be very different, and they don't evaluate that task in this benchmark. And so we need new benchmarks, better benchmarks to do things like this. You can imagine you can create even more realistic patient conversations, data sets with telemedicine consults, where you can source a lot of realistic patient conversations and create even more realistic patient AIs to make even more realistic benchmarks to test this stuff on. So that's the paper overall. Like I said, if you're interested in this sort of thing, I would encourage you to read the full paper. And I hope this has been a helpful summary of some of the most advanced research in this field. And I really enjoyed reading this paper. If you like this content and if you enjoy these sorts of topics, I'd encourage you to follow the YouTube channel and subscribe. Thanks everyone, and see you soon.